So we have now discussed the practical elements of dealing with a choking adult, a choking child and a choking infant. So this is the algorithm for a choking adult. And then on the next slide is the algorithm for a choking child and infant. So really important you're aware of the process, but always remember, don't forget to call 999. That's really, really important. So we are now going to be talking about understanding the individual roles and responsibilities when dealing with an emergency situation. So it's really, really important that you're aware of your personal capabilities, everyone else's personal capabilities. Have you all got the correct knowledge? Is there anybody injured that won't be able to participate appropriately? Is there anybody pregnant that might not be able to do the abdominal thrust? So really important that you know at the beginning of each shift that you understand everybody's roles and responsibilities for if there is an emergency situation. Do you have a specific role in that emergency? Do you know the location of the emergency equipment, whether it be a defib, an anaphylaxis kit? Really, really important you know where everything is. Is everything in date? Has it been checked? Really important, especially in a vaccinating environment. Although it's rare that a patient has an anaphylaxis to a vaccination, it's always a possibility. So really important you know where your anaphylaxis kit is. Speaking from experience, vaccinating in schools for the last 7 years, we always used to allocate roles for everybody prior to each immunisation session. So, and occasionally we'd practice and do a scenario of an emergency situation, as in an anaphylaxis. And then at the beginning of each immunisation session, you allocate everybody a role, what will happen, who will do what in what situation. So who calls the ambulance, who administers the adrenaline. Really, really important everybody knows their roles, and like I said, everybody is aware and everybody that's given the role has enough knowledge and training in that department. Obviously really important to consider good communication. It can be really, really scary to be in that situation. I've had a patient that had an anaphylaxis to a vaccination, and communication is key. You need to make sure you know that ambulance has been called, everybody is dealing with the situation and they're appropriately, and don't just assume that everybody knows what they're doing. So really important you communicate. Teamwork, obviously teamwork is key, and task management. So having somebody who's kind of the lead for that, whether it be a school or whether it be a session, everybody knows who is guiding everybody, who's leading on that situation. Okay, so the next thing we're going to be talking about is understanding individual responsibilities. So obviously healthcare professionals have no legal obligation to offer help in an emergency environment, and your medical professional bodies will give you that instruction. So I'm just going to outline what each medical professional body kind of says that you need to be doing this as part of your role. So starting with the Nursing and Midwifery Council, they state that you should always offer help if an emergency arises in your practice setting or anywhere else. And to achieve this, you must only act in an emergency within the limits of your knowledge and competence. Arrange wherever possible for emergency care to be accessed and provided promptly, and take account of your own safety, the safety of others, and the availability of other options for providing care. With the GMC, or the General Medical Council, they state that you must offer help if emergencies arise in clinical settings or in the community, taking into account your own safety, your competence, the availability of other options for care. And for health and care, the Health and Care Professions Council state that registrants must promote and protect the interests of service users, work within the limits of their knowledge and skills, and use their judgment to make informed and reasonable decisions. You must keep up to date with and follow the law, the guidance, and other requirements relevant to practice. So the main outcome of this is you must work within your capabilities. You must protect the safety of yourself and others. You must, really importantly, keep your skills up to date and work within the remits of the law. So, in the situation of reporting an emergency event, it's really important you follow this step-by-step guide. So first report of an emergency event will be by the rescuer to the emergency services of the in-hospital emergency team. And if they're a lone rescuer, they'll need to do this themselves, otherwise they will ask someone else to do it for them. So they use the SBAR tool. So the S stands for situation, so a concise statement of the problem. So you say, hello, this is Mary ringing from Plymouth Community Hospital. We have an adult male who is not breathing. You then have to have the background, so the pertinent and brief information related to the situation. So you could say, he said he had indigestion this afternoon but collapsed in the dining room. So just giving them a bit of background information. And this is when you're ringing for an ambulance. Oops, sorry. Where were we? There we are. So then an assessment. So this is basically the analysis and consideration of options. So you can say we've started CPR and someone has gone to get the defibrillator, just so they know the situation that you're dealing with. And then the recommendation. So this is where it's the action requested or recommended. So can you come as soon as possible? Is there anything else we should be doing? Just so you know that you're definitely doing everything that you should be doing and what's recommended. So all in-hospital cardiac arrests are reviewed and audited. The National Cardiac Arrest Audit, or the NCAA, is a UK-wide database of in-hospital cardiac arrests and is supported by the Resuscitation Council in the UK and the Intensive Care National Audit and Research Centre, the ICNARC. For out-of-hospital cardiac arrests, data is collected by the UK Ambulance Services. And following a cardiac arrest, it has been found that debriefing staff is an effective strategy in helping them deal with such stressful events and is a useful strategy to improve resuscitation performance. So with the recording of emergency events, it's important that you gather all the information you need, so patient's details, the date, time and location of cardiac arrest, who attended, interventions such as CPR, rescue breaths, use of pocket mask, bag, valve mask, time of the AED arrival, analysis and shock if advised, and subsequent shocks. The most important part of all this is to debrief with your staff. It's a stressful, high intense situation, so really, really important everybody can debrief afterwards, and also to learn from it and what possible changes you could make in the future to make it maybe slightly improved if it ever happens again. Not everyone wants to receive CPR, so it's important to respect people's wishes and to make sure that they're offered a chance to make choices that are right for them. So what do you understand by the term DNACPR, which is basically do not attempt cardiopulmonary resuscitation? So a DNACPR decision may be made and recorded. It might be at the request of the patient themselves, if they are possibly at end-of-life care. It could be a shared decision, so that's made by the person themselves and their doctor and or other healthcare team members, that the likelihood of CPR being beneficial in their current situation would not outweigh the potential burdens and risks of receiving attempted CPR. By the healthcare team, because CPR should not be offered to a person who's dying from an advanced and irreversible condition, and therefore CPR will not prevent their death. Bearing in mind, CPR is a very, very traumatic situation where you could possibly break ribs, etc. So if CPR isn't going to offer them the chance to stay alive, then CPR should not be offered. So it's not offered to everybody, but obviously the healthcare team will make that decision. It could also be by the healthcare team because the person themselves is not able to contribute to a shared decision, and a decision has to be made in the best interest. So it's always important to know what you're doing is in the best interest of the patient. So there has now been a change slightly, but it's not changed everywhere yet, that the do not resuscitate policy has changed slightly, and it's called RESPECT. And RESPECT stands for Recommended Summary Plan for Emergency Care and Treatment. It's not just a replacement for a DNACPR form. The aim is to promote recording an emergency care plan by many more people, including many whose respect forms will recommend active treatment, including attempted CPR if it should be needed. And obviously, the respect form will supersede the DNACPR form when it finally comes countrywide and everybody's using it. And this will be a gradual transition from the DNACPR form to the respect form. It's by locality. So until the respect process has been introduced locally, the DNACPR documentation remains valid. It also, the DNACPR or the respect decision should be reviewed whenever the patient's condition changes and prior to any proposed move between care settings. So it could be they're moving from a hospital to a hospice where their situation may change with regards to CPR. A time frame for review should be stated on the form when it's first signed. It's really important to understand that healthcare professionals must start CPR without delay to have the best chance of success. They will start CPR unless there is immediately information available, clear documentation available to show that this is not appropriate. You must start CPR unless this clear information can be shown otherwise. So that's the end of our webinar. Unfortunately, you can't ask any questions because this is pre-recorded, but thank you everybody for listening. Thank you for requesting this webinar, and that is the end of our basic life support level 2 update. Thank you.